6 days a week, 12-hour shifts.
You can always do something right, even if it's going wrong.
Is this what you want to do, or is there something else you would like to do?
Get a mentor. We live a life of abundance.
Hello everyone, welcome to the show, Coffee with Kunal. This morning we have Dr. Daryl D Dichoso here with us, who is a physician, of course, being a doctor. Now in the past we've had real estate industry leaders, realtors, different people come on the show, but it's the first time we have a physician. Now Doctor's journey has been really interesting. He's of course a leading physician in the Houston market, but what his background is, it's what makes it really interesting. Welcome to the show, Doctor.
Thank you. Good to be here.
So share with us, I know you are a leading physician in the Houston market. Walk us through your journey of coming to the country. I know your family is originally from Philippines. Right. You came in, you did your high school, undergrad, all those things. Walk us through your journey, Doctor.
I was born in Houston.
Okay.
My father and mother met here back in the 67, 68. They were 2 of 200 Filipinos here in Houston at the time.
2 of 200?
Yeah, right.
And that was back in 68?
68, 67.
And how many of people from Filipino origin are in Houston today?
I think it's between 1 to 200,000.
How many of them are yours? So it's grown from 200 to 200,000 plus people.
Right.
So your dad came to Houston, your mom came to Houston, and they met over here.
Right.
All right.
So my father was a medical student in the UST, which is in Manila, the same school I actually went to. We can talk about that later. But he was called on by Baylor, Baylor College of Medicine was looking for residence applications at the time because there weren't a lot of people that wanted to be doctors at that time, surprisingly. And he was second in his class, so he got invited to come over. He had been doing an internship at Clark Air Force Base. He was interested in coming to the United States, so he said, sure, why not? And so he hopped on a plane, came here, didn't have any connections here whatsoever, showed up Baylor College of Medicine, started his fellowship, residency, then fellowship. He became the first kidney specialist out of Baylor College of Medicine in 71, 72.
Wow.
And met my mother, had us. I was born and raised here. I went to most of my grade school years in St. Thomas Episcopal in Maryland. Mm-hmm. Transferred my last 2 years of high school here in Dulles High School. Went to the University of Houston, did undergrad, did grad school there. Among those years, spent a year at the NIH in Maryland doing some research at the National Institutes of Health. And then throughout my journey, decided I wanted to be a physician. During the 90s, everybody wanted to be a physician, unlike the 60s. And so I was on waiting list here in Texas for a couple of years. My father had the bright idea, said, you know what, you don't understand your culture. You need to understand where you came from. I think you should go back to the Philippines.
So he shipped you back.
He shipped me
born
back.
and raised in Houston, right. And you went by yourself? Did someone go with you?
I went by myself.
Wow.
And so it was a bit of a leap for me, but I was single. I was unattached. I wanted to explore. I was in my 20s, and so I ran to the Philippines and best experience of my life, learned about my culture, learned more about life than I did about medicine, came back here, did my residency in the Med Center here under the Internal Medicine and Pediatrics Combined Program. Finished in 2008, became a hospitalist.
Okay.
Do you know what that is?
Tell us about it.
So a hospitalist is the physician, typically internal medicine certified or family medicine that's had some experience in the hospital. We take patients from the emergency room into the hospital that need to stay there for whatever reason.
Okay.
So if you had a heart attack, a stroke, a car accident, and the emergency room doctor realized that you're sick enough to stay in the hospital, he needs a physician to take care of you in the hospital.
Understood.
And to sort of manage your care. So that's what we do. And so I manage a team of about 20 doctors at Herman Sugarland down the street, and we work with all the specialists to take care of our patients. So going back to my journey, it's been through that I decided to sell my practice to a national company, which was eventually taken over by Herman.
Okay.
And so I've come full circle. I'm now a Herman employed physician under the Memorial Herman Medical Group, and I specifically work at Memorial Herman Sugarland Hospital. And I couldn't be happier. This is exactly where I want to be.
Excellent. So Houston got shipped off to Philippines, and you said you learned more about life over there than actual medical school. So what are some of the key lessons learned that you had from your journey in Philippines for those 4 or 5 years?
No, you'd hear from your parents for all the years that, oh, you don't understand what we went through. So, yeah, Mom, yeah, Dad, I understand. Okay, you went through all these hardships, but you didn't really understand it until you felt it. So you would see people. I went to a great medical school, University of Santo Tomas in Manila, but this immediate surrounding area is a very poor area. And so we would literally see people starving on the street, living in very poor conditions. You have a preconceived notion being born and raised here, what poverty is like, what you think it's like, and then you realize you have no understanding of what it is. Although many people in the Philippines were suffering in poverty, they actually were happy with what they had. They make the most of what they did. They appreciated what they had. They had their faith in God, and they just made the most of what they had. And so I realized I needed to sort of readjust my priorities in life and think about what really matters, which is family, appreciating what you have, our health, and trying to make the most of what you can in your lifetime in humanity, and try to sort of spread just goodwill and help other people. And so medicine was my calling for that.
And I think for us, we take a lot of things for granted. I truly believe America is a country of opportunity. And I came to U.S. I was born in India, and I came to U.S. about 20 years back when I was 20-year-old. And I see the transition where what you see of the world setting from the eyes of when you're born and raised in America, what the true picture is outside of U.S. is very, very different. So, having born and raised in India, I know what poverty is. I know what opportunity, and you were correct back in Asia, people who have not enough money, but they're very happy, they're content. They have a lot of family values that they bring to the table. So I can kind of relate to your journey of going to Asia for a few years, coming back to U.S.
Like that, your question was
anyone born, lesson learned, personal, professional, that's defined who you are today.
I see. So in terms of role models,
can be anything.
Sure. So I've looked at. I don't have a particular role model. My father was. My parents were great role models. They were here in Fort Bend. They have been in here, and they still are here since the 80s. And it's been a journey for them, and they've done their things. They were connected in the community. They had their charitable endeavors. My father's work ethic, my wife's work ethic, my colleagues in the hospital. I mean, the role models I have right now are my colleagues, because if you can imagine a year ago when we didn't really understand COVID, you have like firefighters who run into fires to save people. We were running into ICU rooms with people that were dying, short of breath, coughing COVID everywhere, and we didn't know if we had the right equipment to protect ourselves. But it was the job profession we chose, and we run into these rooms to save people. I work with a team of doctors that are fearless, and they have some of them have gotten sick. Fortunately, they've recovered, but it's scary. You see people dying left and right in the beginning, and you're running into these rooms to save these people. It's very scary. It's very, very exhausting, emotionally, spiritually, physically. And so I couldn't be prouder of the people I work with, other physicians, because it's been very taxing on us.
So their commitment to medical well-being of the patients is inspirational, because you say, yes, you are a physician on the medical field, but then you are serving a patient who has COVID, and a few months back or last year, we did not know what precautionary steps to take, and they would jump into the fire.
Right.
That's amazing. Now, normally what we do is we share the guest's cell phone number on the show. I'm not going to ask you for personal cell phone number because you are a physician. But if someone wants to reach out to you, is there a website, or where can they learn more about you?
I have an email address I'm happy to share.
Perfect.
So it's Daryl, Daryl, Dichoso, Dichoso, at memorialherman.org. And Memorial Herman has 2 N's at the end of Herman.org. I'm happy to field questions as I have time for them. I'm happy to answer questions.
Absolutely. This was a pleasure having you on the show today, Doctor. And it was not about just learning your journey, but your perspective about COVID-19, what inspired you. Really interesting that you were born and raised in Houston, but you went back to your roots, went to Philippines, and got your medical degree from there. Learned about the ways of life, the different aspects of well-being, the different aspects of people when they are not as financially successful, but they're happier. That really defines who you're today. Absolutely, it was a pleasure having you on board, and great having coffee. Guys, that was Doctor. Have a great day, guys.
Thank you very much.
6 days a week, 12-hour shifts.
You can always do something right, even if it's going wrong.
Is this what you want to do, or is there something else you would like to do?
Get a mentor. We live a life of abundance.